Thank you. I move that, in the opinion of this House, the Government of Ontario should commit to equitable access to universal health care for Northern Ontarians, particularly those living in underserviced communities, by expanding the Northern Health Travel Grant Program to include all OHIP-insured services not available within 100 kilometres of a patient's area of residence on referral from a health care or dental practitioner, thereby eliminating the current restriction to services performed by a specialist or in hospital, the broadening of eligible service locations to include out-of-province facilities so that patients have the option to access grant-covered services in locations other than their place of residence, or for the purpose of accessing OHIP-insured services that are not offered or available in Ontario, increasing the accommodation allowance for grant-eligible patients to reflect the average cost of accommodation in a host community and adjusting the allowance on an annual basis to reflect market changes, eliminating barriers related to program application, including modifications to the application process to allow for minor revisions and submission of missing information via electronic means, such as fax or email, and improving processing times by instituting a maximum time frame for the ministry to complete its review of a Northern Health Travel Grant application.
Ms. Campbell has moved private member's notice of motion number 60 pursuant to Standing Order 98. The member has 12 minutes for her presentation.
Thank you, Speaker. It is an honour to rise and debate this motion, which seeks to make changes to the Northern Health Travel Grant Program so that Northerners living in underserviced communities can have equitable access to universal health care. Northerners know and understand that all specialty health care services are not available, and not offered in every small community, and that in the North, health care services are often delivered on a regional basis. We do not expect the exact same access as afforded to Ontarians who live in the densely populated South, but we ask for equitable service, that is, fair access to health care services as afforded to all Ontarians through universal health care. A fundamental tenet of equality of access means that no person should be refused health care based on their inability to pay or ability to pay. But in Ontario's north, where people must often travel hundreds of kilometres and incur significant expenses related to accessing health services, many are forced to go without medically necessary care. Because between the mortgage, the hydro bill and food, there isn't much, if anything, left over. And the program that is designed to help offset the regional disparities and associated costs of accessing health care is not fulfilling its mandate. Over the past few years, my constituency offices have been receiving more and more complaints about the program being too restrictive in terms of the eligible services and locations, the unrealistic accommodation allowance, and having too many application barriers, among other things. There are so many stories from my constituents that they have shared with me which underscore the need for change. I will share a few of those stories with this House in my brief time this afternoon to illustrate the importance of the changes I'm seeking today. Many Northerners mistakenly believe that if their doctor determines that medical care is required which isn't available within their home community, that a travel grant will be covered and their travel will be covered under the Northern Health Travel Grant Program, but this is not the case. Presently under the program, if Northerners are referred to either Thunder Bay or Winnipeg to receive OHIP-insured care, only some services are eligible for a travel grant. Having the visit or procedure covered by OHIP is no guarantee of travel assistance. Recently, a hardworking single mother in Dryden who works at Walmart and who is barely making ends meet took her son to the dentist to have some dental work performed. The dentist informed her that the required work could not be performed in Dryden and that she would have to take her son to Winnipeg. She was told by her dentist that this trip would qualify them for a Northern Health Travel Grant because the care is not provided in Dryden and because the service would be performed by a specialist in a hospital. Despite the fact that this medically necessary OHIP-insured service was performed in a hospital by a specialist, the travel grant was denied by the ministry because the doctor who performed the procedure is a children's dentist and not a dental or oral surgeon. But this technicality does nothing to help this mother who is without the financial means to travel hundreds of kilometres and who is without a say in where her child is referred by the medical practitioner. The government has put this mother, who is trying to look after the health of her child, in an impossible situation where she's trying to give her son the care that he needs, but is without the financial means to incur the travel-related expenses, including ground transportation, overnight accommodation, and meals, to access a service that the majority of Ontarians can access locally and take for granted. A senior citizen in my riding who has required Opiates for many years to manage severe pain caused by 2 separate health conditions is now experiencing resulting liver problems. Her physician referred her to the only clinic within a 1,000-kilometer radius for medical marijuana treatment that will assist her with the pain while she is weaned off opiates. The clinic, located in Thunder Bay, is a 700-kilometer return trip away, and the treatment requires a number of visits. Her travel claim was rejected on account of the Ministry of Health and Long-Term Care not recognizing it as a designated health facility. She approached my office because her small pension does not allow her the luxury of traveling to Thunder Bay and staying in hotels on a regular basis in order to go for treatment. She told me that the government is making her choose between eating and receiving the care that her doctor has prescribed. In another case, a Sioux Lookout woman with diabetes and severe associated foot problems was sent to the orthopedic clinic at the Health Sciences Centre in Winnipeg to see her doctor, who specializes in foot care, for frequent and ongoing treatments. Although this physician operates in a hospital and only treats patients with diabetes-related foot issues, the Ministry of Health and Long-Term Care does not recognize him as a specialist and has consequently denied this woman's travel grant claims. She still has to make several more trips but does not have the money to go. If she doesn't go, she will lose at least 1 foot. These technicalities are arbitrary, wrong, and not consistent with universal health care. It's abhorrent that people should be put in a position where they may have to go without medical treatment because they cannot afford to travel to their medical appointments. It also does not make sense. And in fact, I dare say that it's even cruel that the government would refuse to defray the relatively minimal costs associated with medically necessary travel for early treatment, but would fully fund the significantly more expensive and catastrophic resulting amputation, a consequence of non-treatment. It becomes unconscionable when one considers the statistics around amputations, which reveal terrible patient health outcomes and which precede either another amputation or death within 5 years of the first amputation. For Northerners whose OHIP-insured care is performed by a specialist in a hospital setting, there is still the issue of restricted service locations. Presently, patients are only eligible for grants if the procedures are performed in Ontario by the nearest medical specialist in Manitoba, often located in Winnipeg. But with long wait times for some procedures in Winnipeg, patients have turned to smaller nearby centres for faster care. Such is the case for a gentleman in Kenora who required shoulder surgery following a motor vehicle accident. In this particular case, the wait in Winnipeg was significantly longer than the waits in both Thunder Bay and Winkler, Manitoba. Being that Kenora is located significantly closer to Winkler, which amounts to a day trip, rather than Thunder Bay, which is further away by about 300 kilometers round trip and would have required an overnight stay in a hotel, the gentleman had the procedure performed in Winkler. This saved the government the mileage of about 1,500 kilometres, as well as $470 in overnight accommodations for the 5 trips that were required for his treatment. But rather than look at the bigger picture of the improved patient outcome of accessing the surgery faster and of saving money on mileage and accommodation costs for each of the 5 trips, the government penalized this gentleman for accessing care in a community that is closer than the nearest Ontario location and refused to compensate his mileage for the modest distance increase between Winnipeg and Winkler. The increase in the cost of travel grant is insignificant for the government, but it makes a big impact on this senior's personal finances. Another travel grant claim was denied to a northern patient who had a double mastectomy with a male chest reconstruction as part of gender reassignment surgery. It appears that in this case, the travel grant was denied on the basis that the procedure was performed in a location other than Ontario or Manitoba, despite Montreal having the nearest specialist clinic. The Northern Health Travel Grant program should allow Northerners to have access to more out-of-province facilities so that patients have the option to access grant-eligible services in locations closer to their place of residence or for the purpose of accessing OHIP-insured services that are not offered or available in Ontario. In terms of accommodation compensation, while the Liberals recently made changes in the 2017 budget to allow compensation of more than 1 night, the accommodation rate remains unrealistically low at $100. A person is hard-pressed to find a place to stay in larger centres where patients are often referred, such as Winnipeg or Toronto, for $100 a night. I understand that the intent of this program is to help defray the costs associated with travel to medical appointments, but there are so many other costly out-of-pocket expenditures like food and other medical or personal expenses that to not compensate patients for realistic accommodation costs is doubly punitive. It is for this reason that I believe the maximum eligible accommodation rate should be set at the average nightly cost per community and should be recalculated on an annual basis. In order for the Northern Health Travel Grant Program to be effective, it needs to be easier to access. There are many rules that are outdated or needlessly cumbersome, which result in barriers to access, such as only allowing one travel grant application per envelope, or the complete rejection of an application based on one missed checkbox. When a checkbox is overlooked, the entire travel grant is returned by mail to the applicant, and the original grant must be altered and mailed back to Sudbury. Presently, minor revisions cannot be made by electronic means, such as by fax or email, resulting in delays of months for a single travel grant. Other rules, such as only allowing a single travel grant per application per envelope, seem needlessly bureaucratic. And while the processing times have decreased over the past few years, grants can be approved in as short as 6 to 8 weeks. It can also take as long as 6 months. Approvals can take a very long time to process, and as I mentioned, even if there's a very small clerical error, and sometimes that's just not even a mistake on the part of the patient. Sometimes specialists who are going through these things are going through them so quickly that they just overlook it. And so for patients who have to go back and forth for a number of treatments, they can be left without the money to continue on to pursue their treatment. So before I close, I'd be remiss if I did not pay tribute to the former Member of Provincial Parliament for Port Arthur and New Democrat Jim Folds for his vision and tenacity. This program has been instrumental in increasing Northerners' access to medically necessary care since it was created in 1985, and we would not be here discussing these modest reforms if it had not been for his work. On behalf of all Northerners, I thank him. So I tried as best as I could to relay to this House the real hardships my constituents face when accessing health care in the North, but I was only allotted so much time. I hope that these stories, all taken from recent experiences relayed to my office over the past couple of months, have helped the other members of this House to understand the need for the specific reforms that I've presented today. The Northern Health Travel Grant Program is intended to defray the costs Northerners incur when accessing OHIP-insured healthcare services that Ontarians in other parts of the province do not have to spend when accessing care. The program serves as a lifeline to many Northerners, making the effective coverage and implementation of this program key to ensuring that all Ontarians, regardless of postal code, have equitable access to healthcare. Thank you.
Thank you.